The condition I'm going to be talking about today is homocystinuria. Homocystinuria is an inherited disorder. The body is unable to process proteins properly. There are multiple forms of this genetic condition. The forms are characterized by their signs and symptoms. The most common form will be determined by diagnosing someone with nearsightedness, dislocation of the lens, increased risk of abnormal blood clotting, and brittle bones. The less common forms can cause intellectual disability, such as behavior abnormalities, deficits in attention. It can also cause failure to grow, weight gain at an unexpected rate, seizures, problems with movement, and a blood disorder called megaloblastic anemia. The signs and symptoms usually develop within the first year of life. There have been patients that haven't had this diagnosis until the ages of 5 to 7 years of age. The most common form affects 1 in 200,000 to 335,000 people worldwide. It is more common in some countries such as Ireland, Germany, Norway, and Qatar. Homocystinuria is an inherited condition where the body can't process the amino acid methionine. It causes a harmful buildup of substances in the blood and urine. The amino acids that are typically broken down and removed from the body can't be broken down if you are diagnosed with this condition, and they end up getting built up in the body. Causes of homocystinuria are the mutations in multiple genes like CBS, MTHFR, MTR, MTRR, and MMA-DHC genes. The mutations in the CBS gene is the most common cause. The CBS gene is the one that gives instructions for producing an enzyme called cystathionine beta synthase. The mutations in the CBS gene disrupt the function of this synthase, preventing homocysteine from being used properly. Rarely do mutations in the other genes cause homocystinuria, but mutations in the other genes can cause a buildup of homocysteine in the body. The diagnosis of homocystinuria: doctors will look for certain signs to determine diagnosis of this disease. A lot of times, children who are extremely tall or thin, they are more likely to have the condition. Chest deformities like being concave or convex, or curvature of the spine, or a dislocated lens in the eye are found with patients that have this disease. Patients are usually treated by family physicians or pediatricians. The treatments, unfortunately, have to be continued for their entire lifespan. The inheritance of homocystinuria is inherited in autosomal recessive pattern. Both copies of this gene have to be in each cell have mutations. Parents with an autosomal recessive condition each carry one copy of the mutated gene, but they do not show any signs or symptoms of this disease. People who have one mutated copy and one normal copy of the CBS gene will not have the condition of homocystinuria, but could have shortages of vitamin B12 and folic acid. There is genetic testing available for homocystinuria. The genetic testing is performed to look for one of the genes that could be involved in the disorder. An amino acid screen of blood and urine is performed to check for excess homocysteine. A test to determine the body's response to consuming methionine can be performed. A liver biopsy and enzyme assay is used to check for enzymatic activity. Babies are now offered a newborn blood spot screening to test for this disease, because the sooner it is found out, the easier it is to start treating for the symptoms of it, even though it's an uncurable disorder. Treatments for homocystinuria: there are no cures for homocystinuria. There are some treatment options that patients can do. Some high doses of vitamin B6 are a successful treatment for about half of the people with this disease. Diets low in foods containing the amino acid methionine. They can take betaine, which is a nutrient that works to remove homocysteine from the blood. Folic acid supplements are also utilized for treatment. Complications with homocystinuria. Patients with this disease are at an increased risk for blood clots. Cognitive disabilities. Dislocated lens of the eyes can damage the vision. In the brain, nerve cells are affected. Some of the other life-changing conditions or things with this condition, with the vision problems, they have to be watched very closely with eye doctors and just to check their lenses. The weak bones can cause osteoporosis. They could have bone and joint problems for their entire lives. And again, their increased risk for blood clots, which could also cause them to have a stroke. The pedigree of inheritance. I have the people with the blackened out circle or circle or square have the condition homocystinuria. If the spouse does not have the disease, then their child could potentially just be a carrier of the disease. If each parent has an affected gene, they could pass down the condition to their children, or they could have a child without the condition. Causes and risk factors. A child must inherit a copy of the mutated genes for homocystinuria from each parent to even develop the condition. Parents who carry just one mutated gene may not have any symptoms. The child of parents who both are carriers of the gene has a 25% chance of having homocystinuria, a 50% chance of being a carrier of the gene but not experiencing any symptoms, and a 25% chance of being unaffected and not carrying the mutated gene. Homocysteine levels. Homocysteine is normally formed in the body from the sulfur-rich amino acid methionine. When that enzyme CBS is deficient, homocysteine accumulates in the tissues. High levels of homocysteine mainly affect supporting connective tissue in different parts of the body by making the protein fibrillin unstable, which is necessary to hold the lens of the eye in its normal position, which is one of the main things that doctors look for to determine if this patient has this, is to see if their lenses have become disrupted. The buildup of homocysteine also damages the supporting tissue of the body skeleton and damages the connective tissue in the walls of blood vessels. Here's just a little chart I found that kind of breaks down the term homocysteine is the protein that is being built up in the body, and then urea is a substance in urine, so it's usually found in the urine. So if you have increased homocysteine in the urine, that could be a sign that you have this condition. Other problems are, like I talked about before, are involved in connective tissue, muscles, brain, heart, and blood vessels. Here are some of my references. I didn't mention that the diet for high protein foods needs to be usually limited for some of these patients, and genetic counseling is typically available to determine if patients need to have any further testing done to either diagnose themselves with this condition or to potentially diagnose their offspring with this condition if they are a carrier or have the disease themselves. Thank you.